nurse today.
Hi, I'm Kaylee.
Kaylee?
Yeah.
Kaylee, do you know where you are right now?
I think a hospital.
Okay, do you know what city?
Oklahoma City.
Good job, yeah. Do you remember why you're here?
I have seizures.
That's why you're here, you're right, yes. Do you remember how old you are?
24.
And who's the president right now?
It is Trump.
Okay. So basically, first what you're doing is you're just assessing an overall level of consciousness. She's awake, she's alert, she's answering questions appropriately, so that's what we want to see. So you're just going to ask a series of questions that are easy for her to answer, easy for her to understand, and answer appropriately. So that's what I'm looking for. So this would be normal so far. Next, I'm going to check a few more things as part of the neuro assessment. So Kaylee, I'm going to do a neuro assessment on you. This is just to see how you're doing as far as neurologically with you being here in the hospital for seizures. This is something we're going to monitor really closely. So right now I'm going to shine a bright light into your eyes. I'm going to watch your pupils and see how they react to this bright light. I'm going to turn this big light off here, okay? Okay. Now I'm going to hold her eyelid open, shine a bright light, see how it reacts. And so it's brisk. Check the other eye. And so what I'm looking for there is their size, shape, and reaction. I want to make sure that they're nice and round, they're reacting quickly, and they are the same size. Usually when there is a neurological change in a patient, that's the very first thing that we're going to see is changes in their pupil reaction and shape. And so I'm going to check that really frequently with a patient that has seizures or anything else neurological going on. Okay, Kaylee, so can you raise your arm up off the bed? Good. Okay, can you give my hand a squeeze? Good. So now I'm just checking for motor response and motor strength. So her grip was really strong. She was able to follow commands and lift her arm up for me. Can you give me a thumbs up? How about show 2 fingers? So now I'm checking to see, can she follow just simple commands, and she's doing really well with that. How about the other arm? Can you lift that up off the bed? And then give my hand a squeeze. Good, okay. Can you raise this leg? How about this one? Good, okay. Can you press down with my hands? Good, okay. And press up. Good, okay. So that's just plantar and dorsal flexion and extension. So again, that would, if we see that those are weak or they're not reactive, that would show a big neuro change or neuro deficit in this patient. Kaylee, I'm just going to use the tip of this. It's not sharp at all, but you'll be able to feel a little bit of a scratch. And I want you to tell me if you can feel it, okay? Can you feel that?
Yes.
How about here?
Yes.
Does it feel the same?
Yes.
Can you feel this?
Yes.
Can you feel that?
Uh-huh.
Does it feel the same?
Yes, it does.
How about on your leg?
Mm-hmm. Yes.
And it feels the same?
It does feel the same.
So similar to how when you do a stroke scale, you're going to be checking sensation on each limb. So motor strength, motor response, and now sensation. So you want something that's not going to scratch them or hurt them, but something that they can definitely feel. And you want to make sure that it's going to be equal on all sides as far as sensation. Now I'm just going to kind of do a quick, and this is something that you'll be doing as you're already in the room performing this assessment, but part of this assessment is the overall, is there any neuro symptoms going on? Is she drowsy? Is she complaining of a headache? Is she feeling dizzy? Is she showing any signs of seizure activity such as tremors? Usually you'll see that in their eyebrow, eyelid, facial twitches, in the hands, feet, anything like that. So that's something I can visually assess for, and then I can also ask her, are you having any headaches right now?
No, I'm not.
Are you feeling confused or dizzy?
No.
Anything like that? Any
No.
wooziness,
I
nausea?
feel good.
She feels good. So those are just some simple questions, and you can ask in conversation as you're assessing her. And then our next step after that is what is called a RAS score, such as Richmond Agitation Sedation Scale. And so A lot of patients here in the ICU are going to be under a sedation medication. In her case, she's not on anything, so she should be scored a 0, which is alert, no sedation whatsoever. If she was maybe a little bit tired, a lot of patients have been in the ER for hours and hours, took a long time to get up here to the ICU, especially with seizure history, they can sometimes be pretty drowsy. So if she's showing any signs of drowsiness, kind of drifting off like this, but she's easily woken up to me talking to her, she's opening her eyes, she's easily arousable, that would be a -1, and it goes all the way down to -5 to unarousable. If she is starting to get agitated, a little restless, she's moving her feet a lot, she can't get comfortable, and so that's about a +1. If she's starting to really get agitated, now she's verbally getting agitated.
Get out of my room.
Moving up to a +2, and that will go all the way up to a +5 where she's combative. She's requiring restraints, possibly violent restraints, up to that kind of point. So that's another thing that we score her on as part of our neuro assessment. And the last section would be our Glasgow Coma Scale. And that, I guess, again, is something that we'll have done throughout this whole assessment. I'll be able to assess that as I'm doing everything else. But that's going to be your best verbal response, best motor response, and oh, I'm blanking. What's the last one? Yeah, eyes. Eye opening. So, I already know she's alert and oriented, so her best verbal response, perfect, that's a 4. Her best motor response, she followed command, she had full strength, that's a 5. And her eye opening, alert oriented. So she scored a full 15. So each level of that will score differently depending on how she's answering those questions. And that's how we perform a neuro assessment in the ICU.